We will start by studying the bones of the lower limb. We will begin with the hip bone. The two hip bones, together with the sacrum, form the skeleton of the pelvis. The joints that bind them together are the two sacroiliac joints behind and the symphysis pubis anteriorly. These joints do not allow any movements. Let's look at the hip bone by itself. It is made by fusion of three bones: the ilium, the ischium, and the pubis. Many features of the hip bone carry these names. Let's see. This is the ala, or the wing of the ilium. Its upper border is the iliac crest. It ends anteriorly into the anterior superior iliac spine and posteriorly into the posterior superior iliac spine. This is the ischial spine. Above it is the greater sciatic notch, and below it is the lesser sciatic notch. This is the ischial tuberosity, to which many muscles are attached. This is the part of the hip bone on which we sit. The socket for the hip joint is the acetabulum. This articular surface is called leonate surface. It surrounds the acetabular fossa. This opening in the lower part is called obturator foramen. This is the body of the pubis. This is the superior pubic ramus, and this is the ischiopubic ramus. This prominence is the pubic tubercle. Medial to it is the pubic crest. When we look at the hip bone from the front, we see the inner aspect of ilium and the outer aspect of the pubis. When we put the sacrum with the hip bone at its articulation, we see that in the articulated pelvis, the pelvis is angled so that the ventral surface of the sacrum is actually more horizontal than vertical. The sacrum is joined by the sacroiliac joint and by two ligaments to the hip bone, the one going to the ischial spine and one going to the ischial tuberosity. Now we will study the other bone, which is the femur. It's the longest bone in the body. Let's begin with its upper end. It has a rounded head, a narrow neck, and most of the head fits into the acetabulum and allowing a great range of movement of the hip joint. This is the greater trochanter, giving many insertions to muscles. This is the lesser trochanter. This line connecting the two trochanters anteriorly is the intertrochanteric line. On the back, the two are connected by intertrochanteric crest. This rough area is the gluteal tuberosity. This line in the back of the shaft of the femur is called linea aspera. It has many muscle attachments. This fossa is called trochanteric fossa. Let's look now at the distal end of the femur. These two articular surfaces are called condyles, a lateral condyle and a medial condyle. The notch which separates them is the intercondylar notch. Above each condyle is an epicondyle. Above the medial epicondyle, there is an adductor tubercle, and the line above each epicondyle is an epicondylar ridge or supracondylar ridge, a medial and a lateral. Thank you very much.